Good morning. As Sophia said, I'm Mikayla. I'm the primary occupational therapist in the Myotonic Dystrophy Clinic at the University of Iowa. I've been the primary OT there for the last 2 years, but I've been working as an occupational therapist for about going on 8 years this year. So today I just want to talk a little bit about occupational therapy and how it relates to myotonic dystrophy and kind of the connection there. Some objectives for today's presentation is first and foremost understanding the role of occupational therapy. What is it? What do we do? How does it relate to myotonic dystrophy? And then I want to go through just some helpful tips and tricks. So the first thing will be how to identify fall risks within your home environment and how you can kind of adjust for those. We'll go through just everyday activities and how they can be adapted or modified to increase or maintain independence and safety. We'll discuss some energy conservation strategies and how you can incorporate those into your everyday routine. And then we'll also talk a little bit about some memory strategies. Can everybody hear me okay? I'm not used to the microphone. Okay. So first of all, what is occupational therapy? The American Occupational Therapy Association puts it very beautifully. They word it as occupational therapy is a science-driven and evidence-based profession that enables people of all ages to participate in daily living or live better with injury, illness, or disability. This is accomplished through designing strategies for everyday living and customizing environments to develop and maximize potential. So really, to put it simply, the goal of occupational therapy is to just help individuals remain as independent and safe as possible as they can in their own environment. And when you have different diagnoses, sometimes that can mean we have to modify what you're doing or how you're doing it so that you can keep participating in those important activities. The occupational therapy process, we really look at a lot of different things. That's what I love about OT is it's so holistic. We're looking at the whole person, not just one diagnosis. So first and foremost, if you look at that circle chart there, we're looking at the person. What is the diagnosis? What are the strengths? What are the weaknesses? You know, who are they truly as a person? Then we take into account an environment. So your environment is not just your home, that's a big one, but it's also where you work. It's also where you complete your hobbies at. It's also your sister's home if you spend a lot of time there. Your environment's changing and they're all important. And then third, we're looking at occupation. Now, I frequently get, when I introduce myself as an occupational therapist, I'm told, I don't need occupational therapy either. I already have a job or I'm not working. But those aren't the occupations I'm looking at. Occupational therapy is truly what occupies your time. So it's as simple as getting dressed and taking a shower to the harder things like working, participating in hobbies, taking care of your home. Whatever you're doing during the day, that's what occupational therapy is going to talk with you about. And then right there in the middle, that little sweet spot that the arrow is pointing to, I mean, that's right where OT lives, looking at the person, the environment, and what your occupations are. And the typical OT evaluation that I do with individuals with myotonic dystrophy, first and foremost, I get to know you. I get to know the person. So the diagnosis, but also comorbidities, also other things you might have going on medically. And then we really get into reviewing your home setup, your environment setups. Is it 1 story or 2 story? Do you have a tub shower or a walk-in shower? All those things kind of matter and come into account later as we're talking about modifying things to make it safer. During the evaluation, we get into what's going well versus what's challenging. And we do some more formal assessments. So that includes upper extremity range of motion. So looking at your shoulder motion, your strength of your arms, your grip strength, your coordination, if you're experiencing that myotonic grip, that difficulty opening back up. And then really most importantly, we discuss your goals because occupational therapy is not one size fits all. You have myotonic dystrophy, do this program. You know, it's really custom to you and what your goals are. And then we get into the good part, which is the intervention. And as I just said, it's truly based on what your goals are. And it's a lot of how can we adapt or modify to keep you doing those things that are important to you. And then not only if something's challenging, yes, we want to address that, but what can we proactively address? So just because something's not an issue now, is there a way we can modify it proactively to prevent that fall in the future or prevent it from being challenging in the future? So the good stuff, kind of some tips and tricks that I wanted to go over today. First and foremost is fall prevention. Falls are a well-recognized risk factor for individuals living with myotonic dystrophy. Factors that have been linked to falls in myotonic dystrophy patients include muscle weakness, altered gait patterns, so like a slowed walking speed, decreased balance, or even decreased confidence in balance. So really, the best thing you can do is slow down. A lot of the falls that I hear about come from somebody's in a hurry to get to the bathroom, to answer a doorbell, or to answer a phone. Don't. Slow down. Take your device with you when you're doing those things. It's a lot easier to get there a few seconds later and get there safely than it is to rush and have a fall and wish you hadn't. What goes along with that one is user's assistive device. So if you've seen physical therapy in the past, your doctor's told you to use a cane or a walker or a trekking pole, use that. Even if you're in a hurry to get somewhere, you'll get there a lot quicker if you use your device than if you fall. Another great point is to wear non-slip footwear. So that includes socks, grips, some house slippers, tennis shoes, whatever, just something that has some tread to it. That includes in the middle of the night if you're getting up to use the restroom, because your balance isn't the greatest when you're first waking up in the night. And then some basic environment modifications can be get rid of throw rugs or any type of clutter on the floor. You just want to make sure you have clear pathways, not just for you, but also for that assistive device if you use one. And then make sure you have well-lit hallways for nighttime use. So even as a simple nightlight in the hallway to get to and from the bathroom, even if it's your familiar route, you never know if somebody dropped something in the hallway that you weren't aware of. Occupational therapy is really bread and butter is what we call the activities of daily living, or ADLs. There's 5 different ones. There's eating, grooming, dressing, bathing, and toileting. So I thought we would go through each one of those kind of one by one, talk about what I typically see in the myotonic dystrophy clinic, and go over some adaptive equipment options that I frequently recommend. It is not all inclusive. There's a lot of stuff out there, but I wanted to include just some of the highlights that frequently come up. I don't know what happened with my formatting, but that's supposed to say eating at the top. The first one I'll talk about is eating. In one study that I read, 42% of individuals with myotonic dystrophy type 1 reported symptoms of dysphagia. And dysphagia is just that difficulty swallowing, which can be associated with an increased choking hazard. First and foremost, speech therapy is your best resource for that. I would really recommend a formal evaluation if you're having difficulty with that swallowing. But occupational and speech therapy work together for kind of addressing the whole person when it comes to that. So some occupational therapy things that I recommend is, again, that proactive approach of reducing the choking risk. So really chewing slowly, chewing thoroughly is crucial. Making sure you're sitting in an upright, supported sitting position. So not in your comfortable, easy chair with your feet out in front of you. You really want your body supported in that upright position. And then make sure your family and friends are aware of how to do the Heimlich maneuver. Heaven forbid if they ever needed to do that. It's good to have the knowledge and not need it rather than vice versa. And then I listed some adaptive equipment there, but I'm going to take you through some pictures of each one. So the first one is that blue kind of rectangular material. It's called Dysum, and it is wonderful. It's very versatile. It's a real sticky kind of tacky paper. You can use it for helping to open different bottle styles because it gives you a little bit of extra grip. You can put it underneath your plate if you're cutting food and your plate's kind of sliding around on the table. It's very versatile. We go through a lot of it at the Myotonic Clinic because it's nice. You can just stick it in your purse, stick it in your bag, take it to a restaurant. If it gets dirty, you can rinse it off and keep it, it lasts a long time. So that's really helpful. The second one there is a rocker knife. Sustaining your grip on top of a knife can be challenging, especially trying to coordinate that cutting movement. So what the rocker knife does is it eliminates that need to hold a small grip, and rather you can use a wider grip and that rocking motion. So you're using bigger motions rather than those fine movements. An alternative to the rocker knife is a pizza cutter. That works well too. Kind of a good starting point to see if that grip feels better to you. And then on the far side there, there's some pictures of built-up silverware. Again, sometimes holding that small grip on silverware can be challenging. So having just a little bit extra there on the grip can help reduce that grip strength that you need. I typically tell people to start with lightweight, built-up silverware, so just plastic. However, there has been some research that people prefer the weighted. I always recommend start with lightweight, see if that grip helps before you try the weighted, just because that's a little bit of extra effort when you have the weight there. On the next slide, there's just a couple more. These are two different styles of plates with guards. And what the guards do is they help just a little bit with the scooping. So it's less coordination and you have kind of a backboard there to help you get that. So the first one, the metal one, is one that can be adjusted to different plates. So that's a nice one, like if you're going out to eat at a restaurant, you can take that with you and clip it on. Otherwise, the other one is, it actually has more of a lip to it, and then it has that suction base. So again, you don't have to worry so much about your plate sliding around. The next, two more. Forgot, two more things. Cups. Holding onto a cup can be challenging if you're worried about your grip letting go, releasing, or not having enough strength to carry something. So having a handle is a wonderful thing, especially with a lightweight cup. So the ones on the far side there are just any typical lightweight plastic water bottle. The lid helps a little bit, and then the handle helps too. But I've had good luck with these silicone bottle handles because you can use them on reusable water bottles. You can put them on cans. You can, if you're out and about, that's something you can, again, have in your bag.
How difficult are the silicone bottle handles to put on?
It takes some stretch to get that on there. That's a good question. So you may, if grip strength is challenging, you may need help with that, but. The next one we'll talk about is grooming. So this includes brushing teeth, combing hair, shaving, all that good stuff. This is a great chance to take advantage of an opportunity to conserve some energy. So there's a lot that you do in your morning routine. If you're getting dressed and showering and brushing your teeth, I mean, it takes a lot of energy to get through all of that. So if your bathroom is big enough, if it allows it, that's a great chance to have a chair in there and sit down when you're doing these things at the sink. That way, when you have to use that energy later, that leg strength later, you still have that. And then if shoulder weakness is something that is a barrier, you can, if you're sitting there, you can also use that countertop as a place to kind of stabilize your elbow. So if you're sitting there and you can rest your elbow there, you're not using your shoulder strength to brush your teeth quite so much. It just gives you a little bit of extra, we call it proximal stability there. Some adaptive equipment options. The first two I didn't include pictures of because I'm guessing you guys are familiar with those. But an electric toothbrush, again, tends to have a bigger grip and you're not having to do that brushing movement. You're holding it in place and letting the electric toothbrush do the work. Seems small, but it's another chance to conserve some energy that you can use later in the day. And then an electric razor, again, bigger grip, also less likely of a chance for a cut or injury from a razor. And then on the next slide, I have some pictures. The first one is adaptive nail trimmers. The picture of the nail trimmers there, I want you to imagine it with like a bigger grip to it, because typically they do have a little bit more real estate there for you to press down on, but it suction cups to the table. So rather than you trying to hold those tiny nail trimmers that tend to be slippery in your hand, they can just be suction cupped to the table and you're just having to press down. And then the universal cuff is, there's a lot of different styles of these, but for like the brush or comb that show there, I like those. I like that style because it's adjustable. It's pretty universal, but similar to the water bottle holder, it just slips on there and you can slip your hand through there and you're still gripping it, but it just gives you a little extra support in case you need to relax your hand. And then on the far side is a long-handled comb. If you're trying to do a fancy hairstyle, might not work too well. But if you're just trying to get a comb through your hair, that really helps a lot if you have any shoulder weakness to get to the top of your head or the back of your head without having to lift your arm up quite so high. The next ADL that we'll talk about is dressing. So this includes upper and lower body dressing. And again, with that proactive mindset, balance can be a challenge, leg weakness can be a challenge, sit to complete, getting your lower half dressed. So for getting your shoes and socks on, for getting your legs or your feet into your pants and underwear, just sit down. Don't tempt the fall, don't try to balance. If you're concerned about your balance, sit down. And as we talked about a little bit ago, that morning routine can be exhausting because there's so much going on. So if you know you have to be out the door by 9 o'clock for a doctor's appointment in the morning, and you have to shower and get dressed and eat breakfast and do all that, get your clothes gathered the night ahead of time. That way it's one less thing you have to do. It's one less trip to the closet. It's just, again, conserving that little bit of energy so you have it for later in the day. And then good footwear is crucial for balance. So just making sure you're wearing a supportive shoe, non-slip, good tread, not gonna slip off your foot, it fits you well. I included a picture of a reacher there at the bottom. Sometimes they're called grabbers, but the Dyson we talked about earlier is universal, but so is the reacher. I recommend the reacher a lot. It's great for its standard purpose of picking things up off the ground or things up off of a high shelf, but it's also really helpful for getting dressed. If you're sitting there, because you're sitting down to get dressed, and leaning forward makes you nervous because you're not sure about keeping your balance, you can use that to kind of extend your reach, to get your foot into your pants, to push your socks off. It just helps you keep your stability where you're sitting rather than having to do that lean forward. They also, I'm sure you're familiar with a normal shoe horn. They do sell long-handled versions of those. Again, so you're not having to bend over and fight with your shoe. You can keep your stability where it's at, stay inside your base of support, sitting up tall, but be able to reach down there for the back of your shoe. As I said, good footwear is crucial. It needs to fit to your foot, not be one that's gonna slip off. But tying shoes can be challenging if coordination is an issue or a grip weakness. So they have different options for shoe closures. There's your typical Velcro shoes. They also have elastic shoelaces that look like normal shoelaces. You thread them through and tie them one time, then you can slip your foot in and out of those. And those are nice because they look like your typical shoe. It can be your normal shoe, it just has the elastic laces. And there have been some really nice shoes that have come out more recently. The step-in shoes, one brand that I see a lot, not sponsored, I just hear about it a lot. Kizik is the brand, and they're designed so you can step into it without having to worry about your heel getting stuck.
What brand?
Kizik, K-I-Z-I-K. It's a newer model of shoe, but
Skechers has a good shoe.
Yeah,
do they?
Yeah,
I got a pair on now. It's just a regular shoe with it's got an extra piece of flange in the back.
Have you had good luck with it?
Oh, yeah.
Yeah. I've heard great things about them. I have a pair. Not sponsored at all. I just wanted to try them out for myself. The next one we'll talk about is bathing. So just by nature of taking a shower, it's a higher fall risk activity than standing still at the sink to brush your teeth. You're barefoot, there's water involved, it tends to be slippery. Showers can be fatiguing, which makes the balance or falls more likely to happen. So this is a great time to, again, use that proactive lens. The temperature of the bathroom can also kind of zap your energy. I'm sure you've noticed, but heat sometimes can be a factor in making you feel more fatigued. So reducing the steam can be helpful. So you can lower the water temperature, not the cold, just not scalding hot. So there's a little bit less steam. And also leaving the door cracked to let some of that steam get out. Again, makes it easier to breathe. And then if it's a day where you just don't feel up to it, if you feel shaky, if you feel tired, a sponge bath is always an option. Don't put yourself in a position where you feel like you're doing something that might not be safe. As far as adaptive equipment for the shower, I included 2 different pictures of shower chairs on this slide, depending what kind of shower you have. If it's just a typical walk-in shower, then the far chair, that shower chair, would be fine. I recommend no matter what style of chair a person has, it should have a back to it. That way, if you're feeling tired and you need to rest back, it's there and you're not just gonna slip right off the chair. If you have a bathtub though, the middle picture is a little bit better because it's called an extended transfer bench. 2 legs are inside the tub and 2 legs are outside the tub. So you're actually able to sit down and just slide in if you need to. So that's a nice option for those tubs and you're not worried about that big step over. Regardless of what style of chair, if you do have a chair in there, a handheld shower head is really helpful too. Then you're not just at the mercy of where the water's aimed if you do sit down. The shower chair with that proactive approach, again, if balance, leg weakness, anything is remotely an issue, it's kind of nice to have the shower chair in there, even if you think I've never needed to sit before, I don't need a chair. It's nice to have it as a safety net, that if you did happen to get dizzy or feel weak, you have a safe landing place. And then 2 more things for the bathroom. Everybody should have a non-slip mat that sticks well, just to give you that little bit of extra tread in the shower. And grab bars. Grab bars are wonderful. There's a lot of different styles. There's your standard one you see most often that's permanently installed in the shower itself. And then I included this one because this one you don't see quite as often, but it's a clamp-on grab bar. And those are a great option if you have a tub shower and maybe you're renting and you can't permanently install one because of how your shower is set up. Those are really nice to clip onto the tub because then you can kind of adjust where it's at. And it gives you that extra helping hand for stepping in and out. They do also have suction cup grab bars on the market.
They're not grab bars.
I don't love them. I never recommend them honestly, because at the end of the day, they are still a suction cup.
They say they're
They
not
look
grab
nice.
bars. They say, they disclose on the packaging, these are not grab bars. They're to help you balance.
Right, they're just for you to
Yeah.
hold on to, not.
That's,
Well, but the issue is when they're there and you're losing your balance, and that's what you have, yeah.
Yeah.
So I don't ever recommend those, just because exactly as you guys said, they are grab bars at the end of the day. The next one that we'll talk about is toileting. As I said earlier, falls unfortunately frequently occur when somebody's on their way to get to the bathroom because they're in a hurry. And that assistive device, that walker can sometimes get left off to the side because you think you can get there quicker without it. You'll be safer, you'll get there in a better fashion if you just take that device with you. So try to be proactive about when you need to go. Don't wait until that commercial break when you really need to go. Go when you first feel it. That way you have the time to get there. Adaptive equipment options for toileting are never popular to talk about, but they're really important. If your shoulder motion is limited and you can't get back behind you for adequate wiping, that can be a real barrier. So a bidet is wonderful for that, or flushable wipes instead of toilet paper can make life a little bit easier. As far as actually getting on and off the toilet, they have toilet risers, which just give you a couple extra inches, which makes a huge difference when you're trying to stand up from a surface. And then they also have grab bars that can go around the toilet. Again, there's many different styles of these. Some are based on the floor, like that far picture, and some are based on the toilet seat itself, like that riser picture. But the ones that kind of come around the toilet there are called a safety frame. When we're going through home setup in the very beginning of the OT process, I always like to know exactly how the bathroom is set up. Because sometimes people will say, oh, I have something next to me that I use to push to stand up from the toilet, but it ends up being like the toilet paper bar or something like that. So it's really important. If you're putting body weight on it to help you stand up, you want to know it can support your weight safely. Beyond the activities of daily living, which was kind of the basics, the other big area that occupational therapy focuses on is called instrumental activities of daily living, which is really just a step up from the ADLs. They're a little bit more complex. So that would be like cooking, cleaning, driving, doing laundry, managing your medications, work, hobbies. They take a little bit more physical work and a little bit more mental work to do those. The adaptive equipment options and activity modification options are endless and too much to get into for each category for this presentation. But I did include a couple samples or examples of things that we would talk about. So workstation ergonomics, looking at how your workstation is set up, whether you work from home or in an office, making sure that it's optimal for proximal support, shoulder support, trunk support, to make sure you're able to function without compromising anything or having more pain at the end of the day. I talk a lot about in the Myotonic clinic, adaptive equipment for cooking. And I included this picture over here, a jar opener tool. One of the biggest things I hear is difficulty opening jars, lids, that kind of thing. Dysum, wonderful, but it takes still coordination and that grip strength to do that small turning movement. And if that's too challenging, even with the extra grip from the Dysum, a tool like this can be really helpful because again, it gives you a bigger handle and you can use your shoulder, a bigger muscle group, rather than relying on the small hand muscles. There's many different styles of the jar opener tool out there, but I just wanted to include one picture to touch on that. And then also hobbies, even though they are a necessity. Sometimes they aren't viewed as a necessity, but it's important that you're able to participate in activities that are meaningful to you. So we've even talked about how to find modified video game controllers that are on the market. That way the individual can continue engaging in that. And then another thing OT does is we look at driving, because that requires a lot of physical and cognitive abilities there. So you can, if that's something you want to look into, an OT who specializes in driving could go through a formal assessment of that. And then the last bullet point there brings us to the next slide. Energy conservation and pacing is very, very important. Yes.
On toileting, one of the things I found that I find helpful is called a toilet wand,
Yes. Yep.
because it helps you get to the backside.
So the toilet wand is just an extended kind of piece of plastic that pinches the toilet paper on the end. So if getting your arm back there is challenging, that's a really great resource. It just gives you a little bit extra reach.
I mean,
An alternative to that is also, they're called toileting tongs, which are honestly just glorified kitchen tongs. So if that was something that was challenging, I'm always kind of looking for the frugal place for people to start to try things. Those are a great place to start to see if having that extra reach is helpful.
you can get a toilet wand for around $10 on Amazon.
Thank you for that. Yeah,
'Cause I've got a couple of them. I keep one in each bathroom.
that's perfect. And yeah, that extra length makes a difference. Energy conservation. As I'm sure you all know, it's very important to be mindful of your body. You only get so much energy to work with the whole day. And if you burn through it early in the morning, it takes longer for you to kind of recover and get that energy back. So it's really important that you're listening to how you feel and you're taking rest breaks before you feel completely exhausted. Plan ahead to reduce that feeling of rushing, because when you're rushing, not only are you more stressed, you're going to mentally fatigue, but also you're more likely to have a fall and to burn through your energy because you're moving quickly. Modify when able. So we've talked a lot about that already. That's kind of what OT is all about. But if you can sit down at the sink in the morning, perfect. You saved a little bit of energy there. And then prioritize where you're using your energy. If you know you have a big day coming up, for let's say your niece's graduation party and you're going to be outside all day, don't do your laundry that day. Don't do a bunch of cooking that morning. Really plan ahead, look at your day before you're trying to knock everything out at once. And then ask for help. If you have help available, ask for help when you need it. Something else that frequently comes up in the myotonic dystrophy clinic is memory. Nobody's, especially coming up with names, remembering things you need to do, those kinds of topics. So I included just a few basic strategies here. First and foremost, reduce distractions when you're doing something that you really want to make sure you're doing correctly or you need to remember later. So whether it's an important phone call that you're having or you're setting up your medications for the week, I really recommend cut out any extra distractions. So turn off the TV. Don't be trying to have a phone call while you're also setting up your medications. Attention is a big piece of memory that gets forgotten, but you need to be focused on what you're doing. That way you have a chance to retrieve that information later in the day. Making lists is wonderful, not only so that you have that information to look at later, but also taking that pause, whether it's to write information down, store it in your phone, you're giving your brain that extra moment to really store that information so you can pull it out later. So the making list serves two purposes there. Utilize teach back and repetition. So for example, if you were checking out the doctor and they said, we'll see you for your next appointment Tuesday at 2 o'clock, you could say, all right, I'll see you Tuesday at 2 o'clock for my next appointment. Again, you're just giving your brain a chance to really lock that information in, make it more likely that you can retrieve it later. Use alarms as reminders. So if you forget to take your medications a couple times a week, but not all the time, set an alarm. If you take them at the same time every day, let's say you take them at 8 a.m. And if your alarm goes off and you've already taken it, great, just snooze the alarm. But if it goes off and it reminds you and it saves you from missing them that one day of the week, it's worth having. So alarms can be really great, especially with smartphones. They're always in our pockets these days. So use that alarm feature. And then having a daily routine is really important, not just for physical health, but for mental health. And it's a great way to help you if you, let's say you're doing physical therapy and they gave you a new exercise program. If you have a daily routine, you can link that new task you want to do to something you're doing all the time. So for example, you don't have to think in the morning, I need to brush my teeth. It's just habit. So if you can start to make it your routine that after you brush your teeth, you do your exercises, it gives your brain another connection to try and help you remember to do that thing. Exercise recommendations. We'll get into a little bit here, but Amy from physical therapy is presenting today at 2:00, and she really gets into the details about this. So if you have questions on exercise, I really recommend going to that presentation. It's important for physical and mental health. And it can prevent that disuse atrophy of your muscles. So where your muscles are getting weaker from not being used. Sorry, I'm probably moving. Research has shown to be beneficial using a low to moderate intensity aerobic or strengthening exercise in slow progressive myopathies like myotonic dystrophy. But it is crucial that you're monitoring your body's response to in the moment as well as afterwards. Overexertion, if you overdo it, if you push yourself too far, can have the opposite effect of what you're shooting for with exercise, and it can actually cause damage to the muscles. So really important, it's bolded. Before getting started with exercise, I really recommend that you consult your healthcare team and you get a therapy evaluation to help you start in that right spot to avoid the chance of overexerting or doing too much. One more thing that OT looks at in general, but in the myotonic dystrophy clinic too, is splinting. So with muscle weakness, sometimes your hands or fingers can get stuck in a position that isn't necessarily functional or comfortable. So a splint can be fabricated to improve hand function, reduce pain, kind of depending on what you need. So in summary, it's crucial for physical and mental health to not just stay active, but stay active doing the things that are important to you, those meaningful activities. So whether it's taking a shower or taking care of your home or doing your hobbies, working, whatever it is. And the best physical activity you can engage in is something you enjoy. That's what's going to be most sustainable. Every person's situation is unique, and an occupational therapy evaluation can give recommendations that are specific to each person. And ultimately, the individual's goals are the goals. And that's what I love about occupational therapy is it's really custom to each person, kind of depending what we're looking at for that person. Thank you.
Quick question.
Questions? Yes, please.
The hand and the splints,
Mhm.
are those specific to each individual that they need to be fitted and et cetera?
It depends. Let me go back to that slide. Oops. So the ring splint there, the closest one on the top, that one would be an off the shelf. They're called an ovalate splint. So sometimes occupational therapy could evaluate a hand and say like, oh, you might want to pick one of these up from Walgreens or a pharmacy and see if this gives you a little bit of support. However, the other two are more custom orthosis, and those are ones that could be made custom to you. It just kind of depends if it's more complex or not.
Thank you.
So occupational therapies, do they have cognitive therapy for memory issues?
Yeah, and she asked if occupational therapy works with cognition and memory issues. We look at kind of memory is complex because it's more than just memory, right? There's the attention component, there's the processing component. So we really, typically, if that's a concern, we would do more of an assessment to figure out which area is the issue. And although we can't necessarily fix it per se, how can we modify how you're doing things or modify the environment to make you more successful there? Because if you know that, for example, like distractions are really an issue for you, like I said, you can modify your environment at home that way. Does that make sense? I'm trying to think of how to word it other than the example I gave. So like setting up medication.
It's forgetting words
Okay.
that I know.
Yeah. So the other discipline that works, especially with memory like that word finding would be speech therapy. So that would be another great resource for that. Yes. Yes.
You mentioned the slip-in shoes.
Uh-huh.
So my daughter Renee has SMOs. She has like ankle calf braces. And we use the Velcro because she can't do the others, but I wonder if those would keep her foot in place with those on. The slip-ins. Yeah.
They're supposed to.
Okay.
But every brace is a little bit different, kind of depending how it's made. So I always tell people try them and make sure you're able to return them if they don't work for you.
Okay.
They do have some other styles that kind of zip in the back that are a nice option too. They just open up wider for those.
Yeah,
Thank
we use, my little one is in those, and we use Billy's shoes.
Say it again.
Billy's
Billy's.
shoes, and they unzip all the way, so you can take the entire.
I think I saw them in
Yeah,
the group.
you can find them at Target sometimes, but buying them online. is a little-
What are they called?
Billy.
Billy's.
Yeah, so the.
And what
entire
was this
coverage
one?
comes off.
That this gentleman had, what was that brand?
There's, the
Dimmitt.
Skechers had one that I heard, and then, yeah, and then Kizik is another
Kizik,
brand that I've
that's
heard
good.
quite a bit.
Thank you.
Any other questions? Yeah.
Is there anything that can help support your neck when you're driving? Because sometimes it's tired,
Mhm.
like in the car. Is there anything that help with neck support?
Physical therapy does more with the neck. As far as looking at whether it's a range of motion or a strength, are there some gentle exercises you could get started on? Sometimes we have people try like a neck brace just to give a little bit of support, but the big thing with driving is that you need to be able to turn your head. So that's a good question for like a one-on-one evaluation, because you want to make sure you have that range of motion you need to safely drive while you have the support.
The legal liability.
Is there anything that can be done with a person's driving and you're all it, but you don't know when it's going to happen, but your leg just becomes dead?
The right leg does,
I'm sorry.
like like right leg, the pedal.
Driving leg becomes like dead and you can't use it. Is there any way to prevent that from happening?
Well, it could be positioning, is there a nerve that's getting pinched based on how you're sitting in the car? I guess I would be curious why the leg is going numb. Is it only happening in the car? Does it happen at other times? So I think it would be important to kind of get to the root issue of that. And then there are options. If it's consistently an issue, there's modifications you can have in cars like hand controls or a left foot. They can switch pedals to the left foot if needed. But I think before jumping to that, it would be trying to figure out why is that leg going numb. Any other questions? Yeah.
Okay, so Renee's been having a lot of problems with balance, and some of it really does have to do with, physical therapy, help and stretching and muscles. But what we recently learned is she's having vision problems, like, the droopy eyelids we got. And when that happens, one of her eyes turns out. Okay, and so what the vision specialists are saying is her brain is not connecting with her eye. And so she has no depth perception.
Mhm.
So I just wondered, does that relate at all to occupational therapy, or vision therapy is just a totally different?
In that case, that would be more so vision therapy. That would be within their scope.
Okay, it's just they don't really, I don't know if they don't acknowledge it, they don't cover it, basically.
So while vision therapy is working on the muscles of the eye and trying to get the eye to coordinate,
Right.
Occupational therapy could be working at the same time with, because her eye's doing that, she's having difficulty doing X, Y, or Z,
Right.
lining up to get her sock on.
Yeah.
That's where OT could come in and really truly work on the task itself.
Okay,
Although we're not the ones who would work on the eye muscle, what can we modify in the meantime?
I just wonder why it's not covered by insurance,
Yeah, they
Thank
do
you.
for kids because a friend of mine's grandchild has lazy eye. And it pays for the exercises that she has to do.
Well,
We have to look more.
That may
Probably
be the way to
plan by
address it.
plan,
It's not how
location by
they address it to
location.
the insurance company. Because I get Botox in my calves every 12 weeks, clockwork, because of the spasticity.
Put it way in.
And that's exactly how my doctor put it into the insurance company. Because it wouldn't have paid for the Botox without that. So sometimes you gotta find out what the trick is to the insurance company on how it has to be worded. And that can be difficult unless you know somebody in the industry, somebody at the clinic
And
or
that's why
hospital.
having that supportive interdisciplinary team that's familiar with myotonic dystrophy and working with individuals trying to get equipment and get things set up can be
Yeah.
really helpful.
That's what I found, they paid for my adjustable bed.
That's
Because,
wonderful, yeah.
because the way the prescription got put in, the insurance company paid for my adjustable bed and the pole that I have on each side of my bed. Because of the way it was worded.
Yeah.
Mm.
So I know that's a difficult thing to learn, but a lot of times, if you talk to someone if you don't have, like you have here, I found that if I talk to somebody that even the one I don't know, in the insurance department at the clinic, they're more than willing to try to find the answer.
And the MDF website, as I said earlier in the introduction, has a lot of great resources on there that you can direct your medical team towards if they're not as familiar with the myotonic dystrophy and working with insurance.
Trying to start with those cases where they wouldn't tell us. If we cannot do it, we can find where to refer you, then they can help you with that.
My sister's husband, or my sister has a TBI, traumatic brain injury. And it's taken us a lot to get her the equipment needed.
Any questions? So, thank you very much.
Yeah, thank you very much for coming.